Hello, and welcome to this deep dive from Westferry Times. Today, we're looking at something really crucial as the Scottish elections approach. That's the Scottish National Party's latest set of pledges for improving the NHS here in Scotland. What are they actually promising, and, well, what impact could they have?
Yes, it's definitely the right time to be looking at this. Healthcare consistently comes up as a top issue for voters. These SNP proposals are going to be watched very closely indeed.
They certainly are. And helping us dig into the details today, we have Dr. James Fraser back with us. He's a political analyst who really knows the Scottish scene inside out. Welcome.
Thanks. Good to be here.
So our aim today is pretty straightforward. Unpack these NHS promises, look at the context around them, and get a feel for whether they can really shift the dial. So let's jump right in. First Minister John Swinney has laid out several key plans. Can you give us the sort of main points?
Certainly. Right at the top, there's a pledge for 100,000 extra GP appointments. That's clearly trying to address the difficulty people have sometimes in getting to see their doctor quickly.
Okay, GP access. That makes sense. What else?
Then there's a commitment for 150,000 more medical procedures, things like operations in the 2025-26 financial year. This is aimed directly at tackling those very long waiting lists we hear so much about.
Right, those waiting times are a constant source of frustration, aren't they?
They really are.
Oh.
Another pretty big one is expanding the hospital-at-home service quite significantly. They're aiming for 2,000 beds by 2026.
Hospital at home, so that's providing more acute care, but outside of the hospital building itself?
Exactly. In the patient's own home. It can be quite interesting, both for patients and, for easing pressure on hospital beds.
Mm-hmm.
They're also talking about more investment in primary care, community care, trying to get GPs involved earlier.
Earlier intervention.
Precisely. And finally, there's a tech angle, a digital front door app. The idea is a single place for patients to access health and social care stuff more easily, booking appointments online, maybe repeat prescriptions, that kind of thing.
Okay, so quite a wide range of initiatives there. What's
Yeah.
the initial feeling been? Are people sort of hopeful these will make a difference?
Well, it's been a bit mixed, as you might expect. On one hand, people generally welcome any focus on improving the NHS. That's always popular. But the opposition parties, they jumped on it pretty quickly, voicing skepticism.
How so?
Well, the main criticisms are that the plans lack sort of concrete detail, and perhaps more pointedly, that some of these promises sound quite similar to things pledged before, things that haven't maybe fully come to pass. So there's a level of doubt about, can they actually deliver this time?
Which inevitably leads us to the big question, money. How are the SNP actually planning to pay for all this?
Yes, funding is absolutely key, and their plan hinges quite heavily, actually, on getting more money from the UK government down in Westminster.
Ah, okay. How does that work?
They're pushing for a big 10 billion King Crown Gin to the NHS England budget. The thinking is through the Barnett formula.
Which adjusts funding based on English spending.
Exactly. That 10 billion boost for England should, in theory, mean about 1 billion extra flows to NHS Scotland.
So a lot depends on decisions made elsewhere.
Very much so.
Okay.
And on top of that, they're also calling for a £6 billion investment specifically in pay and conditions for NHS staff in England. Again, the calculation is that this would generate around 600 million for Scotland via Barnett, which could then be used for, NHS staff pay here.
But basing so much on UK government action, that feels like it introduces quite a bit of uncertainty, doesn't it? Especially with different political parties in charge.
It absolutely does. That reliance is a major point critics raise. It creates a potential weakness, you could say, given the often differing priorities between Edinburgh and London. And beyond that, there's also a real debate about whether the sums they're talking about, even if they get them, are actually enough to tackle the sort of deep-seated problems the NHS in Scotland faces.
It's interesting to put these new plans against the backdrop of the SNP's history in government. Have they made similar promises before? How did those turn out?
Yes, looking back is important context. The SNP has consistently talked about improving healthcare over its time in power, reducing waiting times, better patient outcomes, access. These are recurring themes. These new pledges definitely fit that pattern.
But you mentioned earlier that some past promises weren't fully kept. Is there evidence for that? What went wrong?
Well, yes. There are statistics and reports that suggest there's often been a gap between the goals set and what's actually happened on the ground. For instance, despite promises to make it easier to see a GP, we've actually seen the number of face-to-face GP consultations go down quite significantly. Now, some of that might be due to more phone appointments or admin burdens.
But it highlights the challenge.
It does. It shows how hard it can be to turn political pledges into real, tangible change for patients.
So what were the main reasons? Why have some past goals maybe been missed?
It's usually a mix of things. Staffing shortages are a huge one, not having enough nurses, doctors, specialists, particularly in certain areas.
Yeah.
That's been a persistent problem. At the same time, demand just keeps going up. Aging population, more complex needs. Money is always a factor too, the financial constraints.
And COVID, presumably.
Oh, absolutely.
Yeah.
You can't underestimate the impact of the pandemic.
Yeah.
It put immense strain on the whole system, disrupted everything, and we're still dealing with the backlog and the pressure from that. It just made existing problems much, much worse.
Right. So it's a complex picture. Given that history and the current challenges, what are the other political parties saying about these latest SNP plans?
Well, the opposition response has been pretty sharp. Leaders like Anasar War for Labor and the conservatives Russell Finley, they've basically argued the plans aren't bold enough, that they lack sort of real innovation to fix the underlying issues. And they keep pointing back to that track record, saying, look, they promised things before and didn't deliver. Why should this time be different? It casts doubt on the SNP's ability to actually implement these new pledges.
Do Labor and the Conservatives offer their own solutions? Do they have different ideas for the NHS?
Yes, they do. Both parties have put forward their own strategies. The specific details vary, of course, but generally you see them talking about things like increasing funding overall, trying to find deficiencies in how the system runs, and focusing on patient care quality. But, just like the SNP's plans, the feasibility and potential effectiveness of their proposals are also up for debate.
It definitely sounds like healthcare is going to be a major focus in the election campaign. How is all this landing with the public, do you think? Are these pledges likely to change how people vote?
Public reaction seems, well, divided. People are generally glad politicians are talking about the NHS. It matters so much to everyone. Some specific ideas, like maybe the hospital at home expansion, seem quite positive. But alongside that, there's definitely a fair bit of skepticism out there. It comes back to those past experiences. People remember previous promises, see the ongoing pressures, and wonder if these new plans are really realistic or enough to fix things.
So for the SNP, convincing voters that these plans are credible and deliverable is going to be pretty vital for their election chances.
Oh, absolutely. Healthcare is always, always a top issue for Scottish voters. How well the SNP manages to sell this agenda, make it seem believable, make it seem like they have a clear plan to actually do it, could really swing things. If they can't convince people, or if the opposition successfully highlights the weaknesses, well, that could definitely open the door for other parties.
Looking forward then, what are the absolute key things that need to happen for these SNP initiatives to actually succeed? What will make or break them?
Okay, well, several things stand out. First, just effective implementation. Having a plan is one thing. Actually making it work on the ground is another. That needs to be really solid. Then, obviously, securing the money, whether it's getting that extra cash from the UK government or just managing the existing budget well here in Scotland, the resources have to be there.
And addressing the deeper problems.
Yes, exactly. Tackling those underlying issues like staffing levels, capacity problems. You can't just paper over those cracks. And working with healthcare staff, listening to them, that's crucial. Plus, being open and honest with the public about how things are going, the challenges that builds trust.
You mentioned a tech angle earlier with the app. Are there other specific innovations the SNP are pinning hopes on?
Yes, they seem keen on leveraging technology and different ways of working. Expanding the NHS Scotland Pharmacy First service is one example.
Lumiere.
The idea is pharmacists can handle more minor issues, freeing up GPs.
Right. Using pharmacists more.
Exactly. And there's also talk about using better data analytics to see how services are running, spot inefficiencies, maybe improve patient outcomes that way. So yes, trying to modernize how healthcare is delivered.
This has been incredibly insightful. Thank you so much for breaking down such a complex and frankly vital issue for us today.
My pleasure. Always important to discuss.
And thank you for joining us here on Westferry Times for this deep dive into the SNP's NHS pledges. We've looked at the promises themselves, the funding puzzle, the history, what the opposition thinks, how you, the voters, might be feeling, and what needs to happen next. It's clear healthcare is right at the heart of the debate as Scotland prepares to vote. Thank you for watching Westferry Times. We hope this gives you plenty to think about. Please do like and subscribe to the Westferry Times channel for more analysis like this. Until next time, thank you and goodbye.